Okay. Hi, my name is Owen Escobar. I am a student at the A&M Accelerated Program, and this is Project One Professional Identity and Nursing. So, my nursing journey, what kind of got me to wanting to be a nurse? It's pretty multifaceted. There's a lot of different things that kind of led to this moment, but I'll kind of start with the pictures. On the top right, you see me, my father, and my grandfather. Um, a couple years ago, my grandfather he was battling cancer, and I was the one who would take him to his oncology appointments where he'd do chemotherapy. And that was kind of the first time I really got hospital experience and saw like nurses in a hospital setting working, and kind of just opened my eyes because I saw how kind they were to my grandfather, how they kind of built a relationship with him. I thought that was really cool, and it kind of always stuck with me and kind of like led me when I was pivoting from pre-med to what career I really wanted to do. Um, Another big thing is just like my life experience and work experiences. I've kind of done it all. I've done my own mobile detailing company. I worked at a school, an aftercare program, and summer camp program, and I loved working. That was one of my favorite jobs, working with children. Done bartending, waiting, fast food, and then on the far left you see that is my lab I worked at UNC, and that was a biochemistry lab. And that kind of leads me to, and all those jobs kind of like I learned where, like at the biochemistry lab, I learned I did want to be in health and be in like the health field, but I liked bench research, but I knew I wanted to be in clinical and really interact with people more. The job at the school helped showed me I want to work with children. I also liked I wanted to be in a job that was detail oriented, like car detailing, and kind of like all these different life experiences kind of led me to thinking like a nursing career would be an excellent opportunity and field for me because it kind of encompasses all of those things. And there's room for advancement and getting advanced degrees, which I really liked. Another thing was my role model, which was actually my PI at UNC, my boss, and she just really helped. Like I went into UNC, or I applied for this job without even taking as a lab assistant slash undergrad researcher, not in a biochemistry lab, not even taking bio 101, and I had no prior research experience. But here, this woman who got a PhD at Yale and is now a PI at UNC, one of the most like coveted positions for research, took a shot and a chance with me and really just gave me an opportunity to be in an uncomfortable environment, but with the ability to learn, grow, and eventually like do my own research project. And it kind of just taught me how to like not shy away from situations where you're uncomfortable or don't have experience or familiarity with it, and just like grow from it, and eventually like you will be confident. And I loved it. um Next, or going on to that, is the integration of nursing history and core values. For me, the biggest connection to my story is Florence Nightingale, and who's acknowledged as the mother of nursing in that published article on PubMed Central. I just love seeing how she strived for maximum best outcomes while also, or and looked at these things scientifically, but because she had compassion, wanted the best outcomes for her patients. And it kind of just resonates with me because I always want to pursue the best practices for patients, but also acknowledge that like no guidelines or like evidence-based practices are going to like really show like teach you how to like build good rapport with your client. Like you just have to be you it's up to you to like notice like and like to make that effort to connect with your client, or not client, patient, and see what they need. um and just like that really resonated with me in general. Um, Professional identity and nursing theories. I There are three big things that I really want to take into my professional identity. First being accountability. I 100% believe in accountability, and just for me, no matter what job, the second I started, do like do the best job I can possibly do. And I think also for a job as important as nursing, no matter what life is throwing at you on the outside, like from the outside, like when you get into the hospital, when you get into that shift, like you need to hold yourself accountable to providing the best possible care you can each time you clock in until you clock out. And then also just being accountable for your own mistakes. Like everyone's going to mess up, but like you shouldn't blame others or try to shy away from that. Like hold yourself accountable. That way you learn. Another is compassion, just overall providing empathetic, patient centered care, and not only just making sure your patient's taking their meds and doing the treatment and kind of just checking the boxes, but really looking after each individual's physical, emotional, and cultural needs, and really building relationships with um, these patients. And then lastly is lifelong learning. I want to stay hungry to learn the best ways to be a nurse and the best practices in all aspects. And when I hear change is most often resisted because of nurses not wanting to change how they've always practiced, kind of just makes me sad. I think they're too comfortable. You like changes how we learn, changes how we improve, and I just want to be open to learning and willing to change how I practice to be most effective and do the most good. And then as far as the nursing theory that I think aligns with that, I think Jean Watson's Nursing of Human Caring is most appropriate. As I went to her website, the Watson Caring Science, and I just found that it views it as an art. It said it views it as an art and a science, which I completely agree with, because I think a patient's outcome has as much to do with the actual treatments and evidence based practice as it does as just showing your client or your patient compassion, being resilient with them, and showing empathy. That those soft skills are so valuable in better patient outcomes. And then for nursing specialty exploration, I have so many different I want to do, but for this project, I did one that was really big, or I have a really big interest in, which is pediatric oncology. I found that some skills that are really important for this position is one, just understanding pathophysiology. Like you're not going to just want to do these treatments and not understand how they work while we're doing them. And then I also think that's important because you're going to be the one with the patient and their family, and you want to be able to educate them and explain to them what's happening, why are certain side effects happening, and why they should be doing these treatments. Though another is just learning how to manage side effects from chemotherapy, because you're going to be dealing with nausea and all sorts of bad adverse side effects, and you're going to really want to become familiar with how to manage these types of side effects and be able to give your patient the most comfort while they're going through this as possible. Another is going to be developmental and psychosocial care. I mean, if a kid is battling cancer, you're most likely going to be a part of their lives for a very long or a very extended amount of time. So, you want to be there and help them progress, and as a child, this is a traumatic thing they're going through, but so you want to make sure they feel safe with you, and you have a good relationship with them. And then finally, family centered care. It's also very taxing for the other family members and super emotionally difficult. So you want to be able to communicate with them effectively and make sure that they're you can address their needs as well. An association I found was the Association of Pediatric Hematology slash Oncology Nurses, which their mission is to support and advance nurses and optimizing outcomes for children, adolescents, young adults, and their families throughout the continuum of care of blood disorders and cancers. Members are dedicated to promotional optimal nursing care for those patients and ensuring they receive the highest standards of patients and care. From playfully encouraging a child to take their medicine to making critical decisions that save lives, pediatric hematology oncology nurses truly make a difference in the lives of their patients. And then a certification I found was the Certified Pediatric Hematology Oncology Nurse, which, in order to get it, you have to be an active RN, 24 months of RN experience within the last 4 years, a minimum of 2,000 hours in pediatric oncology nursing, and then 10 hours of continuing nursing education in pediatric oncology. And then moving on to a vision for professional goal. Like I said, pediatric oncology is one of the big ones, but truth be told, ICU, ER, even research nursing all interest me. I have no idea really, but if I did go through with pediatric oncology, I do this because I think it aligns with my values of always striving for the best, and because this is such, I feel like this is a field that like is constantly researching better ways to like help these patients, whether that's with treatments or like the soft skills and like everything that's not the treatment for these like for these kids and patients. And that kind of just aligns with me like being hungry to do the most, like to always improve these like outcomes for patients, like not just be, oh, it's good enough, we save enough people, we help enough people, like how can we save more, how can we help more people more effectively. And so I think I would really like that aspect of this field. And then two goals for that would be to get the CPHON certification with after 2 years in the field. And then eventually I'd like to become like a pediatric nurse practitioner that specializes in it. That picture, the screenshot is from the Pennsylvania program, but I'd be open to any really. And then a personal factor that could come into play and impact my growth and learning would just be the fact that I'm a Texas resident, but I went to UNC for my first degree and I loved it, but I have a lot of school debt from that program or degree, and I'm also more debt from this degree, and I don't like I want to pay that off as quickly as possible, and I don't want to continue or get into more debt and continue education until I've paid off this really. So I could see that, delaying how quickly I'm able to like become a pediatric nurse practitioner. And like, I just want to make sure I maximize like being efficient and working somewhere where I believe I'm being paid like well, so I can pay off school loans. So that's a big one for me. And then these are my citations. I got one from the CMB or PubMed Central, and then one directly from Gene Watson's website, and then of course the certification website. Thank you.